Okay, so hello and welcome. Thank you for joining us today. I believe this is the seventh talk we're having. Some of the previous ones, in case you missed them, were on thyroid, PCOS, gluten sensitivity disorders, kids' health, environmental toxins, and estrogen related
Woman.
disorders.
Yeah.
So I'm Farah. If you haven't virtually met me before, I am a registered dietitian and an integrative and functional nutritionist. I work at the Chiron Clinic in Dubai, and I also teach nutrition to undergrad students at Zayed University. So I'm happy to be here with you today, and hopefully we will try and give you a good enough idea as to what insulin resistance is and how it can be managed, considering it's a super, super complex topic.
Thank you,
Aman?
Farah. Thank you, Farah. Hi, everyone. I'm Amal Ismail. I'm a functional medicine practitioner based in London. And I'm really excited to be here with you today because when I was learning functional medicine and learned about the intricacies of insulin balance, dysfunction, and its potential impact on multiple chronic health conditions, it was just incredibly fascinating to me, and how much our lifestyle has a significant impact on modifying that very, very important master hormone in our body. So I'm really excited to share this knowledge with you because in my clinic, and I'm sure Farah sees the same thing, I would say 90% of my patients have insulin resistance going on, whether it's early stages or it's evolved into metabolic syndrome or diabetes or even further down the line in terms of other chronic conditions like non-alcoholic fatty liver or PCOS or so on. So I hope this is going to be an illuminating talk for you. It is, we have tried our best to simplify it, but the topic is quite complex. So bear with us. The recording will be available on the website. So should you want to listen to it later. And of course, the slides are also available on that recording. The other thing I wanted to mention is I'm probably experiencing insulin resistance myself at this current moment. My 2-year-old daughter is at home with me because there was a case of COVID in her nursery, so it closed down. So trying to manage work and a toddler and lack of sleep definitely drives insulin resistance, and we'll cover it today. So so let's get started. Just going to share my screen. Okay. So just a disclaimer, as we always start, the whole information in this talk is primarily for educational purposes only. This is not to substitute any advice from your primary physician. So please, if you have any questions or concerns, do take them up with a healthcare practitioner. And especially if you are interested in any of the supplements or interventions that we discuss, that you do so under the supervision of a professional. All right, so what are we going to what are we going to cover today? So essentially, we're going to talk about an introduction to insulin resistance. Now, insulin dysfunction can range from hypoglycemia to insulin resistance to later on hyperglycemia. It's a very extensive spectrum. We can't cover all of it today, so that's why our focus today is going to be on insulin resistance. And we're going to highlight drivers of insulin resistance, so what impacts it, and how can how can insulin resistance then become a driving force for the development of chronic disorders. And we're going to discuss how to effectively assess it and test it accurately, and talk about nutrition, lifestyle, nutraceutical approaches that can help balance our insulin. So let's talk about, let's get started with the basics. What are the major sugar balancing hormones? These are involve insulin, which most of you would be familiar with, as well as leptin, ghrelin, and PYY. So insulin is our main focus for today, and it's the hormone that's produced from the pancreas. in response to you consuming foods that contain carbohydrates. And it directs glucose basically into the cells so that it can then be either stored as fuel in the liver or stored as fat or used as fuel via the mitochondria. The other hormones, ghrelin and leptin, are your hunger and satiety hormones that help manage your meal intake, your dietary intake. So there's a very intricate balance between all of those hormones. So, for example, leptin is really made in your adipose tissue, so that's your fat cells, and if your body has high levels of fat, then you will have high levels of leptin, and then your brain recognizes that you have plenty of stored fat and sends the signal that you no longer need to be hungry, and so it suppresses your desire to eat. If you have low leptin levels, then your brain believes that you don't need to store more fat, and so it signals you to eat, to basically signals you for hunger. Ghrelin, on the other hand, is basically made in your stomach. I'm sorry, I'm completely confused this up. This is what happens with lack of sleep, like caring for a toddler. So leptin is your satiety hormone, and ghrelin is your hunger hormone. So ghrelin is the one that is made in your stomach, and it signals appetite and hunger and fat storage. And leptin, on the other hand, is the one that suppresses appetite. Okay, and they work in unison with insulin. So, what happens with a normal insulin response? You eat a meal that has carbohydrates in it, glucose in the blood increases, and then so the pancreas responds by releasing insulin, and then the insulin receptors are on the cells start to respond to insulin. So there's a glucose transporter that's inside the cell, goes to the membrane of the cell, glucose attaches, and then it enters into the cell, and that's converted in the mitochondria into ADP energy. So what happens when you have insulin resistance? Um, Basically, if you have high intake of a high caloric intake, then you end up with a very high dose of glucose into the blood. Pancreas responds with high release of insulin. But what happens is that you end up with hyperglycemia and hyperinsulinemia because uh, insulin is being released, more glucose is being pushed inside the cells, but then the cells get full that there's no longer they can no longer take any more glucose in, and so that's why you have hyperglycemia. But also the receptor becomes less responsive to insulin, and that's where you get hyperinsulinemia. So, and with that, you end up with developing things like pain and cardiovascular disease, obesity, infertility, fatigue, depression. And all of these disorders that occur as a result of insulin resistance um, uh, basically evolve over time. You can have insulin resistance and develop all these symptoms over a period of 15 years before you actually develop type 2 diabetes, and then from then on progress to further down the line where you need actual exogenous insulin. So, what drives insulin dysfunction? It's inflammation. Inflammation is the driver of insulin dysfunction. So, what causes inflammation are things like mitochondrial dysfunction, poor lifestyle, environmental toxins, so high toxic burden, altered body composition. So, whether we're pear shaped or apple shaped, so we have increased either visceral fat, so fat around the organs, or we have increased adipose tissue. Microbiome imbalance. So if our gut is microbiome has dysbiosis, so imbalance in the gut flora. If we have intestinal permeability or leaky gut, if we have enzyme deficiencies, and so on, and then genetic predisposition. So if we have some variations in our genes responsible for lipid metabolism, insulin, glucose metabolism, detoxification, hormone recycling, all of those have an impact on potential inflammation. And then as a result, normally inflammation precedes insulin dysfunction, and then that drives what we're covering today, which is insulin resistance. And when you have insulin resistance, I'm going to discuss with you in a short while how this can then drive common comorbidities that we see, like obesity, type 2 diabetes, sarcopenia, type 3 diabetes, which is Alzheimer's, cardiovascular disease, increased breast cancer, cardiometabolic disorders, hormone imbalances such as PCOS, infertility, osteoporosis, and so on. So you can see that addressing your insulin balance is really critical, because people who have persistent chronic disorders and um, are struggling to get them into remission or reverse them, generally tends to be there is a challenge with them, with their ability to balance their glucose and maintain that state of homeostasis, which is important in the body. So most of the complaints that are often seen with insulin dysfunction include fatigue. So this is where you have an afternoon or midday crash, or between your meals or after your meals. If you have impaired brain function after the meal, so you feel like brain fog or tiredness or low brain endurance, frequent urination, again, is a sign that potentially there's insulin dysfunction, sugar cravings after meals, insomnia, inability to stay asleep or inability to actually fall asleep. We'll talk about circadian rhythm in a bit. Will Mood swings, anxiety, depression, um, because of the hormone imbalance effect, hair thinning, um, and PCOS. As I mentioned before, we have a whole talk on that. So if you want to dive into more the intricacies of insulin resistance in driving PCOS, please visit that talk. And then impaired metabolism for weight loss or gain. So we see weight resistance challenge, weight loss resistance, or weight gain resistance. And then difficulty exercising, but then when you exercise, you tend to feel better. So the things that are highlighted in blue are where commonly seen more prominently in insulin resistance. And the others are more associated with hypoglycemia. So why is it important that we talk about insulin resistance? I wanted to pick two very important chronic disorders that we often don't think about insulin resistance when we are faced with them. So breast cancer and reducing your risk of breast cancer, as well as Alzheimer's. So in breast cancer, insulin resistance plays a very important role in both estrogen positive breast cancer and triple negative breast cancer. So with ER positive breast cancer, what happens is um, uh, when you have visceral adiposity, so increased fat around the organs, you end up with increased insulin release, because the fat tissue, I'll talk about it in a second, actually starts to behave like an endocrine gland and start to actually produce hormones. And also, we know that increased visceral adiposity it starts to also increase production of estrogen. So you can get estrogen produced through your fat. So what happens is, with this increased insulin, with this increased estrogen, you end up with an increased circulating level of estrogen in the blood. And at the same time, we have reduction in your sex hormone binding globulin, which is think of it as the bus that carries your hormones around, and it has a stronger affinity for testosterone than estrogen. But it's really important, because hormones shouldn't be left alone to do they always have to be chaperoned. They can't just be free, otherwise they will have a significant impact on the body. So what happens is, when we have a reduction in sex hormone binding globulin, we end up with an increase in a free estradiol and testosterone. And that basically increases the risk of breast cancer, because we also end up with increased angiogenesis, which is development of blood vessels, and then also increase neoplastic cell proliferation. So this is what we end up with, an increased risk of breast cancer. So um, addressing insulin resistance early on is really important as a way to prevent breast cancer, but also even in breast cancer remission, it's really critical to ensure that we make sure that there's no insulin resistance. On the triple negative side of breast cancer, what happens is that the high insulin drives androgen levels to go up. So that's your DHEA and testosterone, the sort of male hormones, as we call them. This combined with genetically defective aromatase enzyme. So this is the enzyme that converts testosterone to estrogen, because that's where estrogen comes from testosterone. So if you have a genetic defect in that enzyme, plus you have high insulin, because of increased visceral adiposity, you have high androgens. This results in a very low estrogen supply, which doesn't allow the cancer cell itself to become an estrogen receptor positive cell. So that's how you end up with triple negative breast cancer, or what one of the theories, at least, which is well documented in science. So it's important to measure insulin and testosterone in women because we can really make a big difference, especially when I see a lot of patients with hormone imbalances in the current time. When we think about Alzheimer, again, there's a great research done by Dr. Dale Bredesen that where he a lot of his lab work, and have written lots of books and very successful protocols. And he's doing the first study that's looking at impact of lifestyle interventions and nutraceuticals on reversing cognitive decline with much success. So this is one of an older paper, but what's important to know is that type 3 Alzheimer's is now called as type 3 diabetes, and it represents a form of diabetes that selectively involves the brain, right? So where we actually have impaired energy metabolism. So we have insulin resistance in the brain, but not in the rest of the body. So when you have impaired energy metabolism, you mean you can't, glucose can't get into the cell, and fat is not oxidized, you can't generate energy. And so that's what affects a cognitive decline in the brain. This is, of course, coupled also with there's mitochondrial dysfunction going on, there's high oxidative stress, there's DNA damage. So it's much more complex, but we know that type 3 diabetes is now is the new or the new description for Alzheimer's. So how do we assess it? Most important question to ask yourself: do you experience any change in your energy or function after you eat? Because if you do, then there is an imbalance. Okay, that's your first sign. Doesn't mean that you're going to develop diabetes tomorrow. That means that there is either hypoglycemia or insulin resistance that you need to address. So how do we look at that? So we look at that by evaluating insulin dysfunction across those parameters. So basically, we look at normal glucose with a normal glucose response. You wake up with energy, you feel rested, you wake up with an appetite, hunger between meals, but you have, your cue is hunger, not sugar cravings, and you have no change in function between meals, i.e., you don't feel lethargic, or your energy increases, and you also don't have a reduction in brain function, and you don't have any fatigue. So when you have functional hypoglycemia, is that when you wake up with difficulty, you have no appetite in the morning, you need caffeine or sugar to get you going, you really lose function between meals, and your energy fluctuates after meals. So you actually, when you eat, you feel better because you're in this hypoglycemic state. You crash around 3 to 5, and you have difficulty staying asleep throughout the night. Insulin resistance, on the other hand, is when you again you wake up. This is where you wake up not feeling rested. Okay, and this is also associated with an adrenal health and a low cortisol awakening response. But essentially, that's where we see that you're feeling not unrested. You wake up with sugar cravings. You eat high sugar and high starch breakfast to get you moving. You have sugar cravings all day, and especially after meals. You have fatigue after meals. You crash, especially after lunch. You need stimulants after meals to keep you going for the day. You feel like your brain is shutting down, and you have difficulty falling asleep. These are really big signs. But first ever sign is: do you feel any change in your function after meals? That's a really important question to ask yourself. So let's dive into the pathophysiology of insulin resistance. So let's talk about the organs that are responsible for insulin release, uptake, and secretion. So we have the pancreas, we have the muscle, and the liver. These are your major organs that are involved in insulin and blood glucose regulation. So when there's a defect in your pancreatic B cells, then you have reduced insulin secretion. Okay, you're not producing enough insulin. And we'll talk about why that happens. Muscle, you have inefficient glucose uptake. So the muscles, the receptors are no longer sensitive. They're not absorbing the glucose into the cells. Liver, you have increased endogenous glucose secretion. So there's breakdown of glucagon and release of glucose into the bloodstream. So from a functional medicine perspective, if you've listened to our previous talks, we talk about the matrix and the different systems that are involved in the management of overall health and homeostasis. So when we think about pancreatic cell defects, that's where we think about mitochondria and toxins. When we think about a muscle defect with regards to insulin resistance, we think about body composition or sarcopenia, loss of muscle mass. When we think about the liver, we think about potential inflammation, toxins, inability to biotransform, so detoxify, and then fatty liver. Okay, but there's the major roles of these organs are don't also work in a vacuum because they're supported or have affected by the following contributing let's say tissues and organs as well. So we have adipose tissue, as I mentioned. When we have excess adipose tissue, then we end up with increased free fatty acid production. When we have imbalance in our digestive tract, so dysbiosis in the microbiome, or intestinal permeability, leaky gut, then we have reduced incretin effect, and I'll talk about that in a second, what that is. Pancreatic alpha cells, they start to increase glucagon secretion. The kidney starts to increase glucose reabsorption. And then the nervous system also has a massive impact. So stress, autonomic dysfunction, or adrenal imbalance. So all of these are potential contributing factors. So so that's why in functional medicine, we look at the story of your life is the story of your health. So what has your life been? What mediators you've had? What triggers you've had? Antecedents that have resulted in the development of insulin resistance or continue to promote insulin resistance. So the idea is that insulin dysfunction is essentially, think of it as a very complex web, right? It's a disorder of physiological vicious cycles. There's vicious cycles at play, and it involves it involves us that we have to untangle those cycles to understand where is the root cause and address it. So the first one I want to address, which is often not covered or talked about, which is mitochondrial health and insulin resistance. So the mitochondria is the little factory inside your cells, every cell of your body, that generates energy. So it takes fat, carbs, and proteins and turn that into energy that the body can then use for all its functions. The brain, heart, and muscles consume the largest amount of ATP produced by the mitochondria. Now, mitochondria is really important because it helps maintain normal blood glucose levels by supporting healthy secretion of insulin, okay, from the pancreatic B cells, and improves the responsiveness to insulin in the muscle and the liver, right? So when we have mitochondrial dysfunction, there's two types that can affect insulin resistance. One, you have too few mitochondria, so you don't have enough um, of these factories to power up the receptors that need to basically travel up to the cell membrane to connect to respond to insulin and then pull the glucose in. So that's where you end up with reduced insulin responsiveness and you have insulin resistance. Or you have poor quality mitochondria, so they're weak mitochondria that they are not able to drive production in the pancreas. So they're not able to produce enough insulin, and that's where you get with hyperglycemia because there's too much glucose floating around and not enough messaging from insulin to the cells to take it in. What impacts mitochondrial health? Very much so are your lifestyle. So lack of sleep, toxic exposure, smoking, inflammatory diet, trauma, stress, all these factors, some medications are very toxic for your mitochondria. So your lifestyle has a very important impact. Exercise, lack of exercise depletes your mitochondria, and creates weak mitochondria. Exercise really helps. Cold exposure, whether it's through ice baths or outdoors. So all of these factors are really important. So you understand that mitochondria is so critical in managing insulin resistance. So if you're experiencing a lot of fatigue, you need to think about two things. Am I having insulin resistance due to inflammation that led to mitochondrial dysfunction? So then we have the gut microbiota, and this is a really it's very hard to cover this in such a short time. But what I want you to understand is that the gut microbiome there's more and more research coming out that shows its important role in metabolic balance. And there's multiple pathways. The ones I'm going to talk about today is the incretin effect. So actually, the gut microbiome acts to some extent as an endocrine organ because it produces hormones, GIP and GLP-1, that essentially support insulin production. And studies have shown that if you get an IV glucose drip versus ingesting glucose orally, there's a 2 to 3% high, 2 to 3 fold higher insulin secretion response from oral intake versus IV. And to show you the power of the microbiome in breaking down glucose as well as optimizing the responsiveness to insulin. So the other aspect is short chain fatty acids, which come from eating fiber. So when we have low fiber in our diet, healthy, good fiber from coming from vegetables and legumes and so on, um, we end up with if we have a reduction, we end up with low short chain fatty acids, in particular this compound called butyrate, which results, which impacts then um, uh, 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 intestinal wall repair. It will impact the incretin effect. It will impact immune response. And so it's really important that the greater level of fiber we have in our diet, we end up with better tight junction repair, so reduced leaky gut. We have better stimulation of the incretin effect to better improve insulin response. We also activate the Treg cells, which are help reduce inflammation and intestinal glucogenesis as well. So this is a schematic. This article is available. You can go read through it. It's nicely written out, but it kind of gives you a more in-depth insight into it. But one of lots of studies that have showed that in treatment with prebiotics and probiotics, especially intake of the strain was L. acidophilus, yes, for 4 weeks, preserved insulin sensitivity compared with placebo, significantly preserved it. So there's a lot of interventions that look at gut microbiome. With my patients, I always look at their gut microbiome and optimize that, because if we don't optimize the gut microbiome, it's very difficult to optimize glucose control. Chronic stress, another major factor, and I'm sure many of us are experiencing stress in the past year and ongoing stress. I definitely am. But it's important that we understand the impact of stress. So um, when you're stressed, you end up releasing a hormone or increasing the release of the hormone cortisol. Cortisol is a glucocorticosteroid. So what it means, its primary objective, one of its main roles, is to uh, uh, regulate glucose release. So what happens is when your cortisol goes up because you're stressed, glucose is released. So the stores they are release glucose into your blood, right? And then what happens is that increase in glucose then pushes the pancreas to produce more insulin, and then more insulin, more glucose, but then the cells are full, they can't take any more in, and so you end up with insulin resistance again, or hyperinsulinemia. So, and then you get into that vicious cycle. So managing your stress is absolutely critical in reducing or in controlling your insulin resistance. And we can talk a lot about ways in which to improve that signaling from the brain, from the hypothalamus pituitary adrenal pathway, are things like sleep hygiene, meditation, journaling, yoga. All of these things help reduce your cortisol to prevent this ongoing glucose demand that is triggered by the stress. Then I want to talk about circadian rhythm. So circadian rhythm is basically the rhythm that runs your system, okay? And it's basically your wake sleep cycle. And it's absolutely critical. There's tons of research around it. One of the pioneers in this area is called Dr. Sachin Panda. You can look up his work there. But the circadian timing system is basically responsible for coordinating many of your daily processes. So everything works like clockwork in the body. And so this includes your daily rhythm in human glucose metabolism. So that's why um, your the your sleep wake cycle is so critical for your glucose metabolism. So the central clock, um, which is driven by the suprachiasmatic nucleus, is essentially regulates food intake, energy expenditure, and whole body insulin sensitivity. Okay, really important. So these actions, they're then fine-tuned by peripheral clocks. And what I mean by peripheral clocks are organ clocks. So for instance, the peripheral clock in the gut regulates glucose absorption. Okay, peripheral clocks in the muscles, they and the adipose tissue and the liver, they also regulate um, local glucose absorption. And then peripheral clock in the pancreas, they regulate insulin secretion. So it's really important that we understand that any disruption in our circadian rhythm, uh, where we basically don't have a regular sleeping pattern, we sleep at odd times of the night, we're having irregular sleep duration. All of that impacts our ability to regulate our hormones the next day. Again, this is I'll leave you with this graphics that you can dive into it. And sleep loss is really a big factor. So your insulin sensitivity occurs at night. Okay, so your body becomes more sensitive to insulin during sleep. So this is why it's very profound, because one study looked at people who are sleep deprived, and you'll see that they have they in the study it showed they have a decreased in insulin sensitivity. So one single night of sleep deprivation, so less than 5 hours of sleep, caused a 40% reduction in your ability to handle glucose. That's huge, and I'm sure that you guys have all experienced it when you've had really bad sleep, broken sleep, little sleep. You wake up in the morning, you're feeling tired, you're craving sugar, you want caffeine. That's because there's your insulin sensitivity has been reduced, and as a result, the balance then of your leptin and ghrelin hormones are also out of balance. So remember, I mentioned those earlier. So when your insulin, your leptin, and your ghrelin hormones become unbalanced, then you experience inappropriate hunger or satiety. You have fat gain. You increase blood sugar in your levels. Um, you have pre-diabetes or eventually type 2 diabetes, and it becomes a vicious cycle, because that in itself then starts to disrupt your sleep, because you end up with inappropriate melatonin signaling, which you need to fall asleep and maintain your sleep. And so your metabolic hormone levels affect your circadian rhythm, and your circadian rhythm vice versa affects your metabolic hormones. So that's where sleep is really important in managing. Oh, sorry. And then let's talk about exercise. So exercise and insulin resistance. Um, so having a sedentary lifestyle where we're not exercising leads to insulin resistance. Okay, it drives inflammation, and that leads to the mitochondria in your muscle to break apart, and so you don't have enough energy produced, so you get fatigue and pain, and that then promotes more sedentary lifestyle. And then the more you don't exercise, the more you have reduced motivation and to initiate it, because you end up with disruption of your dopamine pathways. So it's very, as you can see, it's really a complex web. So it's really all these factors, all those lifestyle decisions that you make on a daily basis have an impact on how well you can manage your glucose and prevent insulin resistance from occurring. Now, while sedentary lifestyle is really bad for you, so is overexercising. So there is this metabolic overtraining syndrome that occurs, where you want you want to train but not too hard, where you end up losing the benefit and creating actually insulin resistance. So with athletes who have like long endurance runners, or people who have intense weightlifting training and so on, high intensity or high intensity cardio training. If you want to do that, that's fine, as long as your diet, your nutrition, and your sleep is supporting you balance that impact, right? So overtraining is just as bad as not exercising. That's the key message. Okay, and then I'll just highlight environmental toxins. So this is really important. We covered this in detail in our detox talk end of last year. So I encourage you to go to that talk. But essentially, we're exposed to environmental toxins on a daily basis, whether it's from plastics, pesticides, air pollution, cigarette smoke, uh, uh, chemicals in our cosmetics, in our cleaning products. Teflon, non-stick pans, processed food, all of these chemicals, they cause a significant disruption and cause, you've heard about also endocrine disrupting chemicals. So this is what it is. It's basically they're disrupting our hormone balance because hormone balance is so intricate. And so how do they do that? They can do that directly by acting as endocrine disruptors. So they mimic the effect of the hormone but have a negative impact. Or they do that by impacting the microbiome, which then it eventually leads to insulin resistance. Or it can impact your liver detox pathways, which eventually leads to insulin resistance, or it can actually disrupt insulin signaling pathways, or it can increase oxidative stress, more inflammation, more insulin resistance. So it's really important to look at your environment and take stock of, do I have a high toxic load and how can I reduce it to support my body and reduce inflammation and balance my insulin. And then finally, what I want to leave you with a message is that having covered a lot of topics here is that you need to be mindful of these signs and symptoms and get tested. Don't ignore those symptoms because insulin resistance, as I talked about, or insulin dysfunction, whether you're on the hypoglycemia range or on the insulin resistance hyperglycemia side, it creeps up on you with time, and 15 years down the line you're developing type 2 diabetes, and then you're like, where did this come from? And then after that, it's and if you don't pay attention and address it, that can evolve to more complex type 2 diabetes condition, or even worse, develop breast cancer or Alzheimer's or so on. So it's really important to be mindful of those symptoms that we discussed earlier. So look at your lifestyle. If there's lack of physical activity, if you're overeating, if you have high sugar, if you have low fiber, if you have chronic stress, all of those factors, as I highlighted, result in development of insulin resistance. And it starts with things like fatigue after meal, or always craving sweets, or difficulty losing weight. And that then comes into what I see in the clinic is fatigue, joint pain, depression, infertility, so on. So how do we test? Important to test. It's not enough to just do a fasting blood sugar. That's not enough, or just an HbA1c. We have to look at multiple parameters because, as you can see, multiple organs in the body impact insulin balance. So BMI is really important. Waist to hip ratio is really important. And I've highlighted the optimal ranges here. So less than 0.8 for women, less than 0.9 for men. So that's the smallest part of your waist divided by the largest um, uh, part of your hips. And then fasting blood sugar, your fasting insulin, your HOMA score, HbA1c, and expanded lipid panels, really important because we know that inflammation drives insulin resistance, which leads to imbalance, lipid metabolism imbalance. So it's a sort of gateway towards cardiometabolic disease, and we'll cover that in our coming talks. But a lipid panel, so things like cholesterol, triglycerides, LDL, HDL, VLDL, particle size and number. So there's a much more expanded panel that we'll cover in the next talks. Inflammation markers. Inflammation precedes insulin resistance. So high sensitivity CRP, looking at a CBC, a full CBC with differential, so that we look at ESR, platelets, and so on. Liver function and homocysteine. Elevated levels of homocysteine or increased levels of GGT, they signal high toxic load and signal a risk for developing cardiovascular disease. Also, uric acid, chronically elevated, is not responsive uric acid is a sign of insulin resistance. Key nutrients, vitamin D, B12, magnesium, these are essential for liver function and essential for mitochondria. So any deficiencies in those will impact your insulin resistance and your kidney. We didn't cover a lot about it today, but microalbumin creatinine ratio is important in this angle. So this is for your perusal, but this slide essentially is to kind of start to think about, where do I fall in terms of severity of insulin dysfunction? Am I really at the early stage where there's postprandial elevated glucose, or am I all the way down to starting in the pre-diabetic, diabetic range? So these are some of the clinical signs and symptoms that I've listed here, how it evolves. And then these are the lab results, what we typically see, right? And it kind of gives you an indication of, well, potentially you're in that severity level, and you need to start taking stock of your lifestyle and improve your health. We can, of course, dig deeper, and that really depends on the patient timeline and matrix assessment that we do at the clinic. And this is where we look at your gut microbiome. So if you're coming with also symptoms of bloating, chronic constipation, acid reflux, we have to look at the microbiome and what's going on there, or signs of intestinal permeability. If you have nutritional deficiencies, so people who've been yo-yo dieting, people who've been doing intermittent fasting for a very long time, without particular guidance, people who have eating disorder histories, people with illness, and so on. So we need to look at that. Adrenal stress, really important. Stress is such a critical factor in throwing off your insulin balance. Looking at hormones, so if patients have infertility or PCOS or any or estrogen dominance or so on, males with low T, again, look at insulin resistance, genetic susceptibility. I mentioned those earlier, and then any mold, heavy metals or organic toxicants. If there's a patient that we've cleaned their diet, they're sleeping well, they're exercising, all their blood panel looks good in terms of their insulin and so on, and glucose and so on, but they're still having symptoms. That means there is an organic pollutant or heavy metal or mold that is creating inflammation in the background, that which persisting the problem. So that's why we look at that. And then we look at oxidative stress and liver detoxification pathways. So really the message is you have to optimize your lifestyle in order to prevent the development of insulin resistance or insulin dysfunction that can lead to the development of these chronic disorders. It really, the power is in your hands. So sleep hygiene is really important. Sleeping roughly around the same time, making sure you're away from screens and avoid blue light, maintaining a cool, dark environment during sleep, avoid any Wi-Fi in your room or your phones. Stress management, really critical. You can't really manage stress with just taking adaptogenic herbs. That's not sufficient. You actually need to look at your lifestyle, because you need to help balance that cortisol release throughout the day and the melatonin release throughout the night. So meditation, journaling, and breathing. Regular exercise, really important. Nutrition, Farah is going to cover all of these in a lot of detail. Reducing your toxic exposure, and some of the nutraceuticals that we leverage, and of course also pharmaceutical interventions. But these are fantastic substances that we lean on, especially when we have early insulin resistance, because they've been very well studied in terms of their effects, such as berberine, resveratrol, ALA, glutathione, butyrate, all of these things, which actually have been tested against current pharmaceutical products that have been used in many studies, and the effects are phenomenal, because also a lot of the nutraceuticals, they have a benefit beyond the intended use, so beyond just managing insulin, such as berberine, for example. So I hope that this gave you an ability to reframe how we look at chronic disease through the insulin resistance lens. And remember that the real voyage of discovery consists not in seeking new landscape, but really in having new eyes. And that's what we hope that we've opened your eyes to look at it in a different perspective and see that there you have really the power and the capacity to make that change, prolong your lifespan and your health span. Thank you so much. I'll pass on to Farah.
Thank you so much, Amal. That was fantastic, as always. I really liked one of your last slides, the reframe one. Thank you so much. Okay, let me start by sharing my screen. Okay. Okay, so I will be continuing from what Amal was talking about and discuss nutrition in a little bit more detail. No doubt this photo made some of you crave some sugar. I hope not. Okay, so my disclaimer as well. So, of course, all the recommendations and advice I give are not meant to be used on an individual basis. They're there to guide you, so please do keep that in mind. And as always, in terms of functional nutrition, integrative nutrition, personalized nutrition, each person presents with their own unique history, with their own background, their lifestyle. So it's really important that we target our recommendations based on those factors. So we often find that what works for one person is not necessarily going to work for somebody else. So throughout my presentation, I'll discuss some dietary factors that can potentially help an insulin resistance. I will speak a little bit about exercise, stress, and sleep, since Amal mentioned that earlier, and then discuss some of the natural supplementations or alternative medicine that can be used. Okay, so again, food is always seen as medicine in functional nutrition. So it's really hard to talk about insulin resistance without talking about obesity. We don't know which comes first. Okay, so the chicken and the egg, it's that scenario. So we know that with obesity, with the greater fat mass, adipose tissue, this triggers inflammation. It triggers abnormalities in endocrine reactions that take place in adipose or fatty tissue. And then this releases free fatty acids. And then this free fatty acids further releases other pro-inflammatory cytokines, hormones, which all eventually lead to insulin resistance at the liver level and at the muscle level. And then for when we do have insulin resistance, insulin can also trigger an increase in fat in the body. So again, we have to target both, but really with weight loss, when we implement whether weight loss strategies, we really see improvement. Even a loss of 5 to 10% of body weight, we can see improvements in terms of insulin sensitivity, reduced inflammatory markers, improvement in other cardiometabolic parameters, in general, improved metabolic parameters, and it can even affect blood pressure and blood lipids as well. So even a small loss in weight can really have significant health impact. And we know, of course, that high sugar intake is a main contributor to weight gain and obesity. So a high carb diet with that constant bombardment of elevated sugar levels, this is continuously going to elevate insulin levels in the body over time. We're talking, years. So cells stop responding as efficiently as they did to insulin. So this excess glucose and as a result excess insulin starts to lead to poor insulin sensitivity and insulin resistance, and of course inflammation, and then that cascade of events. So a high carbohydrate diet, a high particularly sugar diet, is really one of the main culprits in terms of high levels of obesity that we see nowadays. And another factor, of course, in terms of sugar, let's say sugar intake, is the high amounts of fructose that individuals are consuming. So with the low dose fructose, we find fructose in fruits, but we also find it in sugar. In honey. And of course, one of the biggest challenges nowadays is the high fructose corn syrup. So in general, with low dose fructose coming from fruits, this normally, the small intestines clear this fructose out to produce glucose and organic acids. However, the problem happens when we are talking about high dose fructose. So in large amounts, again, possibly coming from, soft drinks, carbonated beverages, and other foods, for example, high fructose corn syrup. So what this what this leads to is it causes leaky gut or intestinal permeability. It can lead to oxidative stress, inflammation, and insulin resistance. So it can really affect, it can affect us at the microbiota or gut microbe level, but it can also affect us in terms of increased inflammation. So one of the biggest challenges is really to get people to consume minimal amounts of fructose. The Mediterranean diet has been studied over and over in terms of health benefits. Um, the Mediterranean diet, even to date, is one of the best diets or even ways of life out there. However, over the past years, it's definitely seen some changes towards more of a standard American diet, a SAD diet. So it emphasizes, the Mediterranean diet emphasizes functional foods, functional nutraceuticals. So not only are the benefits attributed to usually caloric restriction with a Mediterranean diet, which promotes weight loss and promotes insulin sensitivity, but these functional foods and functional nutraceuticals, foods, a lot of it emphasizes foods like fruits and vegetables, whole grains, nuts, olive oil, of course, and then all of these have the functional nutraceuticals like the flavonoids, the polyphenols, alkaloids, which are really, really very beneficial in general. And these benefits in terms of, let's say, reduced insulin levels, in terms of reduced hormone levels, are seen over a long period of time as well, so in the long term. So just to discuss a few of these foods, whole grains, of course, which are extremely rich in dietary fiber. So inulin, for example, beta-glucans, resistant starches. So those, part of the benefits of whole grains are attributed to the fiber component, but also to other functional components like, for example, phytates and phytoestrogens and phenolic acid. So those have really been shown to promote or to regulate the glycemic response. So in general, when we eat a meal with a high fiber content, it reduces that spike of sugar levels. So when we eat, our sugar levels are naturally going to increase. However, rather than them increasing at a steep increase, let's say, or very suddenly, we want them to increase at a gradual pace. So fiber really helps reduce the rate of glucose absorption. And of course, it induces satiety, so it makes us feel full quite quickly and for longer periods of time, which can help with weight management as well. So in general, it can increase insulin sensitivity and improve in general overall insulin resistance. Legumes, which are of course also very rich in dietary fiber, in addition to a bunch of those functional components we see here, like isoflavones, saponins, polyphenols. So they are, important functional foods in the Mediterranean diet. So one of the bioactive compounds, which is called alpha amylase inhibitory peptides, those can really help reduce the digestion and absorption of dietary carbs and balance that increase in blood sugar levels following a meal. So really, those are foods we want to include on a day-to-day basis, switching from anything that's white, refined, white pasta, white bread, and really making the switch to whole grain products. And focusing more, of course, on plant-based proteins like legumes. Functional foods as well, like fruits and vegetables, berries, onions, garlic, cruciferous vegetables like cabbage and cauliflower. Those can really all positively affect insulin sensitivity in general, reduce inflammation. They have antioxidant properties. They can support detoxification. So they have, many health benefits. And also when we talk about insulin resistance. Green tea, the polyphenols, the ECGC components in green tea are also very beneficial and can improve insulin sensitivity and reduce cytokines that are very pro-inflammatory. Nuts as well, very big in the Mediterranean diet. So they can also induce satiety, improve insulin resistance. They can reduce inflammatory markers, and also something to include on a daily basis. So they have a high biological value in terms of their protein content, fatty acid content, fiber as well, and a bunch of other functional components like polyphenols and antioxidant vitamins. So healthy fats, omega-3 fatty acids are very anti-inflammatory. So for example, omega-3 fatty acids like fatty fish, salmon, anchovies, sardines, these are very rich in EPA, DHA, krill oil as well. So all of those can impact insulin sensitivity. And monounsaturated fats like all extra virgin olive oil, avocado, have a significant impact on insulin resistance. So, focusing on those healthy fats, including them again every day, those are a key component of the Mediterranean diet, trying to steer away from saturated fat, which has been shown to trigger insulin resistance, and, making better choices in terms of the types of fat that we eat, again, can improve insulin sensitivity. So there's been a lot of debate on, high carbohydrate diet, low carbohydrate diet, high fat diets in terms of managing insulin levels and managing blood sugar levels. Now, in terms of dietary fat, this doesn't really affect insulin levels right after a meal, but over time, it has been shown to affect blood sugar levels and blood insulin levels. So particularly when we talk about saturated fat. So saturated fat has been linked to insulin resistance. When we talk about saturated fat, we're talking about red meats, we're talking about dairy products. So usually animal-based foods. To a lesser, we do find saturated fat in coconut oil, for example, but it's really, the meat and the dairy that we want to, try and reduce, particularly red meat. So another potential factor that could be triggering insulin resistance is the production of what we call LPS. So with a high fat diet, our gut microbes produce something called LPS that can lead to metabolic endotoxemia. So we know that externally we are bombarded with toxins, but internally we can also produce toxins, and some of these toxins are LPS particles. So the fact that high fat diets trigger the production of LPS, which can trigger inflammation and insulin resistance, can really help us address what we can do in terms of minimizing our intake of fat and saturated fat. Low carb diets, and again, I'll talk about the ketogenic diet in a short while. So low carb diets anywhere from 20 grams, 50 grams a day. So benefits have been found in terms of whether it's ketogenic diets or low carbohydrate diets. However, a few questions we want to ask ourselves. Is this, is it, first of all, is it sustainable in the long term? Can someone follow a low carbohydrate diet, on a long-term basis? What are potential risk factors? And is the beneficial effect we see, is it because of, the low carbohydrate intake, or is it because the total calories is lower? Okay, so, and keeping in mind the phenomenal benefits we see with high fiber intake. So when you are reducing carbohydrates, you're definitely cutting back on the fiber and potentially missing out on key benefits. So in general, studies have shown really conflicting results. Excuse me, among diabetic individuals, those who were following a low carbohydrate, high fat diet were found to lose more weight, have reduced appetite, improved insulin sensitivity, lower fluctuations in blood sugar levels, and lower fasting blood glucose levels. So benefits have been found. However, in the long term, their lipid levels were increased, so cholesterol levels were higher, homocysteine levels could increase as well. So there could be long-term detrimental effects. So it really has to be very personalized, following up with the client, looking at, lipid levels every couple of months, and just, maintaining, monitoring and evaluation in terms of diet and how they're doing. Another concept is carbohydrate timing within a meal. So some research has shown that when you have your meal, when you focus on eating your veggies first and your protein first, when you have, well, this study showed that if you were to have a carbohydrates food 15 minutes later, this really drastically reduced the increase in blood sugar levels after the meal. So there was a beneficial effect in terms of first eating your protein and your vegetables and then eating your carbohydrates. I mean, 15 minutes might be too much, but there, even if you cut that down by 5 minutes or so, benefits will still be seen. I believe this was also done among diabetic individuals, but no doubt, even in healthy individuals, benefits are likely to be seen as well. So focusing on protein and veggies, and then consuming your carbohydrate rich food, for example, brown rice or whole grain bread or the pasta. So again, just to reiterate that whenever we have our meal, and this is, I didn't include any slides here on glycemic index or glycemic load, so this is why I wanted to mention it. A lot of people try and follow, with diabetes, for example, try to follow a low glycemic index diet. So each food will increase your blood sugar levels at a certain level, and then so based on that, they are categorized with an index, glycemic index. However, keep in mind that it's not common. We don't usually eat foods by themselves. We may as a snack, but meals are always a combination of food. So this is where the glycemic load comes into play. So we really want to focus on, having a meal, let's say, with a lower glycemic load, but also focusing on high fiber foods, protein rich foods, and healthy fats, because those can really delay gastric emptying, the rate at which food is leaving our stomach, entering our small intestine. It can make us feel full for longer periods of time, and can really help, as I mentioned earlier, prevent that sudden increase in blood sugar levels. Instead, they are increasing at a more gradual level, to prevent that sudden release or triggering of insulin as well. So keeping in mind, that our meals should contain fiber, protein, and healthy fats as well. So the ketogenic diet has been shown to be effective in terms of reducing body weight, can improve insulin resistance, particularly in obese individuals who have diabetes. They can improve the sensitivity of insulin receptors, so they are more likely to react to insulin, and therefore take in glucose. So there has been documented health benefits, okay, in terms of ketogenic diet. Is it for everyone? Not necessarily. Okay, so it's really important. It has to be on a case-by-case basis, and it has to be, it's got to be a holistic approach. Individuals who might want to go on a ketogenic diet think, this is a fix it for their insulin resistance or diabetes problem, but then, we still need to focus on things like sleep, stress, exercise. So it's not necessarily the only solution. Intermittent fasting as well has so many documented health benefits in terms of promoting autophagy, promoting brain function, optimizing brain function, reducing insulin resistance, weight loss, longevity. So many health benefits attributed to intermittent fasting. Keeping in mind that there are so many definitions to intermittent fasting, right? So there's the 5x2, where on 2 days of the week, you're just eating 500 calories. There is the alternate day fasting. There is the time restricted feeding, which I like to educate my clients on and try to have them follow some sort of time restricted feeding, where you are fasting overnight, let's say for at least 12 hours, pushing it to 13 hours, 14 hours, maybe even 16 hours if the individual can do it. So let's say if you have your dinner meal at 7 p.m. So if you were going to do a 14-hour fast, then your breakfast the next day would be around 9 a.m. And often, I find many clients already do this without being aware of it. So it's definitely got health benefits, though I do want to say a few things. Women with hormonal imbalances may benefit from doing shorter fasts, like 12 or 14 hours. And then also keeping in mind, even the hours between the meals, Um, so we don't want to go on for too long without eating something when you are eating within your time window or time frame. Again, this can affect blood sugar levels and insulin levels. So it has to be done the right way under the right guidance. Okay, so I'll move on to some natural medicines or supplementations that could be used. So a lot of these can be used, even individuals who have diabetes, who are on medications, sometimes they're used alongside medications. For individuals, with early stage insulin resistance, we try to get them on some of these natural medicines so that they do not need medications in the near future. So for example, fenugreek, gymnema, berberine, as Emil mentioned, chromium, fenugreek, as I again just mentioned, coenzyme Q10 and alpha lipoic acid, selenium. So those have all been shown to act in a similar way to some medications that are given to manage blood sugar levels and insulin levels. So spices are very common and can be given even in supplementation form, although keeping in mind, please not, this is something that has to be done under the guidance of, a professional. So fenugreek, cinnamon, turmeric, sumac as well, sumac, those can all improve the digestion and absorption of carbohydrate. They can increase insulin sensitivity. They can lower fasting glucose levels and postprandial or glucose levels after a meal. So those are all the functional components within these spices. Gymnema is an Indian plant, and it means sugar destroying, gormar in Hindi means sugar destroying. And the gymnemic acids, which are part of the leaf, appear to reduce absorption of glucose from the intestines and can also stimulate the release of or the growth of beta cells in the pancreas, which are responsible for making insulin. So research has shown that individuals who have diabetes, who are on hypoglycemic drugs, if they do take gymnema, they may be able to eventually reduce their dose and maybe stop their hypoglycemic drug altogether. So it's really effective. Berberine is also very effective. It's a bitter tasting plant alkaloid found in some roots and stems of plants like golden seal, barberry, and it can increase insulin receptors. It can inhibit the formation of glucose by the liver, and it can increase the hormone that promotes insulin secretion and insulin sensitivity. So berberine as well is a very, very common supplement that's given to manage insulin resistance and insulin levels in general. Black seed, which has anti-hyperglycemic properties and anti-hyperlipidemic properties. Thymoquinone is the active component in black seed or nigella seed. It's been used in traditional medicines for many years, and it can really improve fasting blood sugar levels and hemoglobin A1C. Chromium deficiency is really very common in individuals with diabetes and insulin resistance. So by supplementing maybe anywhere from 400 to 800 milligrams a day of chromium, this has been shown to have positive effects in terms of glucose tolerance, high levels of sugar, high levels of insulin. So in general, it's been found to be very effective. Magnesium as well. So people with diabetics tend to have magnesium deficiency. So up to about 40% of individuals with diabetes can have a deficiency in magnesium. Actually, the majority of us have a deficiency in magnesium. So I believe we can all benefit from taking some magnesium. First of all, from dietary sources, nuts, almonds, avocados, dark chocolate. So in general, going back to its positive effects on insulin, it can really lower fasting insulin levels. Alpha lipoic acid, which is an antioxidant, also has been found to improve insulin sensitivity, especially in diabetics. So I'm gonna go over what Emil was mentioning in terms of when we are constantly experiencing chronic stress, or even if we feel like we're not stressed, but we're constantly thinking and worrying and feeling anxious, our bodies are releasing cortisol. So that even at a low level, that chronic release of cortisol in our bodies can trigger high levels of blood sugar, which triggers high insulin, which leads to weight gain and insulin resistance. And I want to say something about weight loss that I forgot to mention earlier. I find so many clients who have tried who say that they've tried everything to lose weight and can't find the, don't get the results that they want. And because they haven't addressed insulin resistance. So it's really hard to see or, or lose weight if we haven't addressed insulin resistance and if we have not addressed cortisol imbalances. And remember, also with insulin resistance, you're very likely to get leptin resistance as well. Okay, so imbalances in your hunger and satiety hormones. So it becomes really a vicious cycle where you have high cortisol, high insulin, high blood sugar, and things get so messed up. So addressing stress becomes very important. Emma spoke about sleep, and the fact that just one, if you sleep for a few hours for one night, that was my last night actually, and the fact that this can significantly affect insulin and insulin resistance. But sleep apnea is very common, and sleep apnea can be an independent risk factor for insulin resistance and even cardiovascular disease. So sleep apnea, usually assessed through a sleep study, can increase inflammatory cytokines, stress hormones, which can increase, insulin resistance. And another risk factor to sleep apnea is obesity, particularly abdominal obesity, that visceral fat that, is centered across the abdomen. So this is where the waist-hip ratio becomes very important, as Amal mentioned. So visceral fat is really, really something we need to focus on. But sleep apnea can also be very common in healthy individuals. And there was a study that found that in men, in young, lean men who were not obese, if they had sleep apnea, they were up to, I believe, 27% more likely to have insulin resistance. So it's a very important factor that we really need to address. Exercise, again, focusing on even walking, honestly, even walking for 30 minutes on a daily basis, or every other day, doing some walking, doing some even high intensity interval training, weight resistance is really important. And exercise by itself is enough also to help us see positive results in terms of managing insulin levels. So my take-home messages: focusing on functional foods and functional nutrients. So your berries, your green tea, your spices, your cruciferous vegetables, increased intake of healthy fats, including omega-3 fats and monounsaturated fats. So your nuts, your avocados, your olive oil, your fatty fish, fiber and more fiber from whole grains, vegetables, legumes. Oats are a fantastic source of soluble fiber as well, and fiber that can be, oats are also considered prebiotic food, so they feed our good gut bacteria. Regularity in terms of meal timing, practicing some form of time-restricted feeding, ensuring that at meals, even a snack. So I usually tend to avoid, I ask my clients to avoid having just a fruit as a snack. Maybe have, a handful of nuts as well. Okay, so avoid that source of just, sugar, even though it's nutritious. Fruits are super nutritious, but having a little bit of extra healthy fats can really help in terms of balancing that sugar levels. Considering any nutrient deficiencies like magnesium, chromium, vitamin D. Vitamin D deficiency can really drive insulin resistance as well. And then considering as well natural compounds like berberine, gymnema. There's so many others as well, like bitter melon, for example. And remember to sleep better, stress less, and move some more. Thank you so much for listening. I hope that was informative. And we're happy to answer your questions. My email's over here, and please do check out my Instagram as well, which is Wellness in Colors.